No more miscarriage, please. Miscarriage is more common than you think. Worldwide, 10 to 20% of known pregnancies end in miscarriage. The true incidence of miscarriage is likely much higher, and if you've ever had a miscarriage, it's important to know that in most cases you can have a healthy pregnancy afterwards. Abortion refers to the miscarriage of a fetus before 20 weeks of pregnancy, that is, within the first 3 months of pregnancy, first trimester. Miscarriage is sometimes called spontaneous abortion, referring to the sudden and uncontrollable nature of the miscarriage. Symptoms of miscarriage or miscarriage include abdominal or back pain, vaginal bleeding, which may include clots or bloody tissue, cramps or uterine contractions, fainting or dizziness, fever. If you are pregnant and experience any of the above symptoms, you should go to a hospital or immediately see a gynecologist. There are many ways to classify miscarriage. Common categories include 1. Complete miscarriage, in which everything is expelled from the uterus. 2. On the verge of miscarriage, that is, loss of blood, and miscarriage may occur. 3. Fertilized egg implants, but never matured. 4. Recurrent miscarriage, that is, a woman has multiple miscarriages in a row. Ectopic pregnancy. This is when a fertilized egg implants somewhere outside the uterus. The fertilized egg may implant elsewhere, most commonly in the fallopian tube, but it may also implant in the abdominal cavity or cervix. If this happens, the pregnancy cannot be saved. This is not considered a miscarriage because the pregnancy cannot continue to term. Missed miscarriage. A missed miscarriage occurs when the embryo stops developing, but the body behaves as if the pregnancy is still ongoing. A pregnancy loss is only noticed after your obstetrician scans you. This may be especially true for women who are not actively trying to conceive if they don't know they are pregnant, so they don't pay close attention to any symptoms and don't take regular pregnancy tests. But even if you didn't know you were pregnant until it happened, that doesn't mean it won't be hard to come to terms with. It is still important to see a doctor and seek help and treatment. In most cases, miscarriage is caused by 1. Fetal chromosomal abnormalities. This is by far the most common cause of pregnancy loss. If a chromosome is missing or damaged, the fetus will most likely not be able to develop. 2. Environmental or lifestyle issues. Excessive drinking, smoking or drug use can affect fetal development and lead to pregnancy miscarriage. 3. Living or working in a hazardous environment with high levels of hazardous chemicals such as lead, pesticides, or mercury may also have an impact. 4. Medical conditions. Sometimes the mother's health problems such as diabetes, thyroid disease, autoimmune diseases and infections can also cause miscarriage. 5. Reproductive system abnormalities involving the cervix or uterus may also increase the risk of miscarriage. 6. Age. The older a woman is, the more likely she is to have a miscarriage. The risk is also greater if you have had multiple previous miscarriages. If you are at risk for miscarriage and have vaginal bleeding, your doctor may prescribe progesterone as this may help reduce the chance of miscarriage. Progesterone is most commonly taken by mouth or intramuscularly. If a miscarriage is diagnosed, you usually won't need any treatment because your body has most likely passed the tissue. If there is residual tissue, your doctor may need to perform a minor surgery to remove the remaining tissue from the uterus. This is called dilation or dilation and curettage (D&C). Physical recovery. Some women experience spotting and abdominal discomfort and should avoid sex or using tampons for at least 2 weeks after a miscarriage. Your normal menstrual cycle should resume in 4 to 6 weeks. Because a miscarriage occurs relatively early in pregnancy, many may consider it less traumatic than a miscarriage later in development, i.e., stillbirth. But that doesn't have to be the case, as losing a baby at any stage of pregnancy is emotional and difficult for everyone. If you are pregnant or planning to have a baby, knowing the facts about miscarriage and where to get help and treatment is important for your physical and mental health.